recording, you'll know that we're streaming.
Okay. Okay, well, welcome everyone to our meeting. We're still expecting some members to join us. We have a couple of guests tonight, Dorothy and Sally, who are here. They are interested in learning more about our board and are here to see how a meeting goes and gather more information. So maybe during my part, I'll ask each of you to just tell us a little bit about your interest in the board. We may have a third person join us too, for who has an interest in joining the board. And we have Denise Freeland from Mosaic tonight, who is here to give us a presentation on the services that they're offering at this time. So hopefully we'll have a few more members join us. Hi, Jessica and Dr. Dupont. Thank you. So are we at a quorum, Frank, or not yet?
No, we're not yet at a quorum. I think we need 2 more. I'm trying to count now.
Okay, so we will probably have to wait on the minutes.
Sorry. I said there's 6 of us, right? So we need 7, I think. Did we decide if it's a quorum of the current number of members or a quorum of how many members we should have?
Right now, it's the quorum of current members. Oh, and there's Travis, so you should be good now.
Okay, so why don't we go to the agenda. Is there any addition or deletion? Probably not deletion at this point, but anything else I should have on the agenda for tonight?
Looks pretty full to me.
It does, yes, thank you. All right, so
Mary Jan had her hand up.
okay.
It wasn't to add anything, but I just wondered if it was possible to get the agendas out with all these papers a little earlier, because I don't tend to look at my mail over the weekend, and there was quite a bit to read this particular time. Is that a possibility, or is that just doesn't work with the scheduling of everything?
No, it is, and it is our goal to get it to you a week ahead of time. We just had a lot of moving pieces this go around, so our apologies for the late delivery.
Yeah, that's fine. I know how that goes.
Okay, thanks, Jan. All right, so looking at the minutes, can I have a motion?
I'll move the minutes for July 11th, 2022.
I'll second it.
Second from Stu. Any discussion of the minutes? Okay, all in favor of approving the minutes? Okay, I think we've got them approved. Thanks, everyone. I have no board correspondence or announcements to make. Does anyone have any announcements they want to make?
I do have one quick announcement.
Sure.
As seen in one of the OMH documentation, that their New York State Office of Mental Health is moving to provide more more support around the Healthy Steps program. Northeast Pediatrics did look into applying to this program. Unfortunately, we do not have a sufficient quantity of Medicaid patients, which I think is going to be the case across all of Tompkins County, that I don't think it's likely that any medical provider in Tompkins County is going to qualify for the Healthy Steps support that Office of Mental Health is providing for primary care offices. So just kind of wanted to provide that update.
So that's good to be aware of. Yeah. Frank or Harmony, do you know anything about where that plan
I
is?
don't know the particulars of the grant, but I think Jessica's probably right on. If there's a significant Medicaid requirement, I would imagine our primary care folks will not. We can certainly look into it, and we should be advocating to the state that there needs to be, they need to understand different communities have different needs, and we shouldn't be excluded necessarily from these opportunities.
Great, thank you. Any other announcements or comments? All right. All right. So during my time slot here, I thought we could ask Sally and Dorothy to maybe just share a little bit about why they're interested in the board and what your background is. Dorothy, do you want to go first?
Sure, I don't mind. I'm a big talker, to be honest. So hello, everyone. My name is Dorothy Lovelace. I certainly recognize some of you in your names. I've worked in various community services and nonprofits in Ithaca. I've been an Ithaca resident now for 25 years. So I worked for a while at Family and Children's Service, the mental health agency. I worked there in their billing office and helped people on the financial side of managing their care. And then I worked for quite a few years at Racker doing both direct service work, and then I moved into service coordination back when it was still Medicaid service coordination. And I made the choice to go back to grad school right when they were changing the whole program over. So then recently I've been working, I do a lot of outreach marketing and some development of new services for a company that did a lot of like home health, elder care, and disability services. So it's something that I've done. I've worked, with this type of the people that this board kind of serves and advocates for throughout my career. And I have a real, I guess I would say I have a real soft spot for the underdog. And I know how hard it is to like access and really use those services. And we have a great community actually compared to a lot of places, but I always say like anything can always be improved upon, and I have a lot of energy. And so I really want to, bring that to help my community. And this seems like a great way to do it that lines up with my interests and then also with my career background. So thank you so much for having me today. I just really appreciate getting to attend the committee. And please, if you have any questions at all, I'm an open book.
Thanks, Dorothy. Sally, could we hear from you?
I will second Dorothy that, I'd be happy to answer any questions or anything. I've been in Ithaca since 1971 when my husband became a professor of philosophy at Cornell. I went into the linguistics department a couple of years later and have retired as a professor emerita of linguistics. And I've written a lot on various issues. Most recently, I wrote a book called Words and Power that includes just like a couple of paragraphs on language around mental health. And I'm particularly interested in issues of mental health because my family has had, 3 of my 4 grandchildren struggle with very serious mental health issues. And last spring and summer, my son, who had had other issues before, sort of he suffered a very serious psychotic episode and was hospitalized in 2 hospitals, against his will in 2 different hospitals in New York. And, anyway, I dealt a lot with the people here in Tompkins County who were, extremely helpful. In fact, one of the men in the police department was just wonderful, absolute wonder, as my son was taking his son who, has schizophrenia. But anyway, I've become very interested. I always was, but more interested in thinking, how could I help somehow with mental health resources in my own community? And especially stuff connected to matters of how people talk about things and so on. But not only that, I've also, like been a champion money raiser for Hospicare. So I'm, yeah. Anyway, I'm here to just sort of find out more about what you do and whether I might be of use, whether this is, a good place for me to try to be helpful. So thank you for letting me come tonight.
Oh, thank you very much. And Dan Doyle has just joined us too. Dan, we were just hearing from some potential candidates for the board and wondered if you wanted to share a few things about your interest in.
You're
don't-
muted.
Yeah, I don't think you're muted, Dan. Can't hear you there.
How's that? Better?
That's- Yeah.
Okay. All right. Again, technical difficulty. Sorry, I'm late. Yeah, when I saw that there was an opening with the Community Service Board and the subcommittees, I submitted an application just because I was interested. I've been living here 9 years now. We downsized after retiring in Rochester. We're Buffalo natives and moved here. Our eldest child lives here, and we didn't have any family in Rochester, and decided now was the time to come to Ithaca. And so we had retired. I'd retired from working as a clinical social worker for 35 years in Rochester, and 5 years before that, I was working for the state. Matter of fact, I started my career at Elmira Psych Center and then moved to Rochester. So I worked in all capacities of outpatient mental health and emergency mental health, crisis management. Did some administrative stuff, and so when I saw there was an opening on the boards, I thought, well, I don't know if I have much to offer. I've been out of the loop for a while, but Mary and I spoke very briefly on the phone a couple weeks, maybe last week, and thought it would be nice to see if I could be of any help. So here I am.
Thank you very much. Good. Well, our process through the nominating committee, after folks attend meetings, we'll be contacting you to just see what your thoughts are and see what our next step should be. So it's
Okay.
always
Well,
helpful.
thanks for having me. Yeah.
Yeah, it's always helpful to actually attend a meeting and see what
Sure.
what kind of things we talk
Yeah,
about.
I didn't know where it would be most useful, if anywhere. Either on, I got the impression like the Community Services Board was more an umbrella, and then there were the subcommittees, 3 subcommittees, and so that's what I'm at.
Great.
Okay.
All right. Well, thank you for being here, all 3 of you. So let's move on to our next guest, Denise. We're really glad to have you here and to hear more about what's happening with Mosaic. So I'll turn it over to you right now.
All right, well, thank you. And thank you for having me. And I'm really impressed that you've gotten 3 potential members for a committee, because we don't get that in other counties. I will tell you that. We struggle to find committee members. So I am the Vice President of Services at Mosaic. So I oversee all the services for Mosaic. And we are an agency that assists people with developmental disabilities primarily, but we do also work with OMH. We have an OMH contract, and we recently, well, actually over a year now, have had an alliance with Challenge Industries in Tompkins County. So we have a management agreement with them, and I oversee the services at Tompkins County as well. So they do vocational services, and they do a little bit of community have, but pretty much they do supporting individuals, with all disabilities. They just don't deal with individuals with developmental disabilities, any type of disability, people recovering, people coming out of jail. They help them and assist them with keeping employment throughout the community. So I've worked with Harmony on our OMH contract through Challenge. And recently, probably been a couple of months now, Mosaic was named the ARC of Tompkins County, because Tompkins County never had an ARC chapter. It actually was the only chapter in all of New York State that didn't have an ARC chapter. And Mosaic is in the ARC family. We used to be, I've worked for the agency 32 years. This is my 33rd year. Crazy to think about. But we used to be Seneca ARC. And then Seneca and Cuba County merged and became Seneca Cuba ARC, and then ARC of Seneca Cuba. And then in 2020, we merged with Yates County, and that's when we became Mosaic, because Seneca Cuba Tompkins, or Seneca Cuba Yates was way too long. And then when we added Tompkins, Seneca Cuba Yates Tompkins, it's just a mouthful. So we became Mosaic because we are, you know, a blended community, and we say, you know, we're lots of people in one community. We try to build a strong community with lots of different things going on. With that said, when we did our alliance with Challenge, they had a need, Tompkins County had a need for a clinic because lots of services, you know, people have a hard time finding mental health, you know, services and everything. So our Mosaic clinic that started in Seneca County and now is in Cuba, Yates, we actually oversee a clinic in Ontario County, has now come to Tompkins County. So we will be offering services in Tompkins County for individuals with developmental disabilities. That is the one caveat to our clinic right now. We are only approved for someone with a developmental disability. So if they have a developmental disability, they can get a service through our clinic. We are in the process right now of hiring staff to provide those services. The services, I want to get my notes from I'm not the clinic director, and I don't oversee the clinic. It is the one service I do not oversee anymore, but I did previously. We've gotten so big that we had to kind of split things off, and I oversee every service but the clinic now. So I don't want to say something wrong, so they gave me a few notes. So they are going to offer social work, rehab counseling. So for anybody that doesn't understand what rehab counseling is, that's usually, it's kind of like social work, but it deals specifically with your employment. So if you're having issues on the job, if you're having coworker issues, if you're, you know, with your supervisor, that is the person that will help you through that. Now your social worker can do that too. You know, you can get it through social work, but this is an extra, like sometimes, you know, people are only approved to see a social worker once a week. Well, if they can get approved for rehab counseling as well, then they can, you know, have somebody to bounce stuff off more than once a week. Because as we all know, even though somebody might be diagnosed with a developmental disability, they sometimes also have a mental health diagnosis as well, you know, and those fall through the cracks because you don't, you know, you can't cross over services. We were hoping we were going to go to managed care sooner. We haven't yet, like OMH has, so that we could get rid of these silos, but it hasn't happened yet. So they're going to offer social work, rehab counseling, and psychiatry services. Now we still are trying to hire a psychiatrist. I know they're on the cusp of hiring a social worker. I heard today that they had 2 potential candidates that they were vetting to see who they could get. So that would be great. But they will be both in person or telehealth right now, because those options are available through OPWDD at this time. Now we want to say that with the, you know, the caveat that we don't know how long that will go. I think in OMH they have approved to continue with telehealth, but under the OPWD umbrella, they have not. It's still in that Appendix K waiver, and they say that's going to end 6 months after the pandemic ends, if they ever give an end to the pandemic. Because now we're out till October something, right? I think. So, but they are, you know, remote or tele. Referrals can be submitted through our website. So you can go to mosaic.org, and right on the website, you can look for services, and there is a way that you can put a referral form in. Or you can, you know, if the person has a care coordinator, the care coordinator can put a referral in as well. Briggs Seekins, who is the Director of Employment Services at Challenge Industries, he knows how to get the referrals in too. So you can reach out to him at aboutchallenge.org. So, and his email is briggs.seekins@aboutchallenge.org. And we hope to, in the future, bring other services from Mosaic into Tompkins County. But many of the services, especially waiver services, have to go through, which I'm sure many of you are aware of, the whole LOI or RFP, process where, you put in a letter of interest and a thing from the state comes out to say, okay, we're looking for new residential providers in this region. And actually one did just come out in region 2, but it just came out. So we're just looking at it to see if it's even a possibility. But you have to put in a proposal and it has to get approved. And then you have to go through all those hoops. So it won't be something that happens quickly, but it is hopefully something we'll be able to do in the future. And we're hoping maybe even be able to offer some day services like they have down in Tompkins County, if possible. We will not do vocational services in Tompkins County as Mosaic, and we will not do community supports probably in Tompkins County as Mosaic, because both of those are challenge industries already approved for, and we don't want to take away from our alliance with them and the services they already provide. So right now our focus is on the clinic and getting that up and going and getting services out there for people. So that's where we are. Questions? Anything I can answer? Yes, people have to qualify for OPWD to get services through Mosaic. Yes, you have to go through the front door. Typically, yes. And that's, you have to reach out to OPWD.
In addition to that, you also have to have a secondary psychiatric diagnosis. Is that?
You do not. Nope. You do not. Because that's what happens many times is somebody who's diagnosed with a developmental disability, they miss that second diagnosis. So no, they just have to be developmentally disabled, and to be developmentally disabled, whatever, it has to occur before the age of 22.
Thank you.
Yeah. So they could have a traumatic brain injury, different things. But if it happened before the age of 22, you're considered developmentally disabled.
So just to clarify, this will be something that's not currently offered in Tompkins County?
Right.
Is that? Okay.
Yep, it's brand new.
Sally?
Do you have a building or, a space that you're occupying here?
So right now, we are going to be co-located with Challenge Industries, right in their office building on, good gosh, what the heck is the name of the road now? And I go there twice a month. I'm like, Danby Road, it's across from Ithaca College. It's the
Route 90.
building right there. So that's where the in-person clinic services will be held. But if somebody wanted virtual services, we've been doing those right along through the pandemic.
Dr.
Are you?
Go ahead.
I was gonna ask, are you aware that OPWDD has an Article 16 clinic on Route 96 in Ithaca?
Am I aware of that? I am not, but like I said, I do not oversee the clinic. I can give that information to our clinic director and the vice president who oversees the clinic, but no, I was not aware. Where is it?
It's on Route 96, it's right next to the hospital. It's the Tompkins Day Treatment Service, TDS. So they have a day treatment program for developmentally disabled people. But they also have a clinic with a psychiatrist to see developmentally disabled people. I happen to be that psychiatrist.
Oh, okay. I will definitely pass that along. I mean, when they reached out to OPWD and did a survey in Tompkins County, they said the need was there. So. Good to know.
Good to know.
Sheila?
Denise, you mentioned you have 2 candidates for the social worker position. You're looking for you're looking for a psychiatrist, is that correct?
Mm-hmm.
How is that search going? We know the difficulty of, hiring psychiatrists.
Well, because right now, we don't know the number of people that you're going to get or how many referrals you're going to get. When we're advertising, it is a fee-for-service psychiatrist. So it is very difficult to find one. We actually, we have 2 psychiatrists that work between the 4 counties that we're already in. And they already have their own practices and they're, you know, getting to the age where they're gonna want to retire and they cut down on their hours. And we're even trying to find some fee-for-service psychiatrists in our area and we're having a very difficult time. So it is very difficult to hire that position, but we, you know, keep our feelers out there and have been, if you know of anybody, you know.
Yeah,
that
a
wants to-
Yes, a second question if I may, Denise. Just based on what Dr. Duplan just shared, will there be any coordination with, you know, the Dr. Duplan's clinic or with Dr. Duplan?
Oh, there definitely would be if we were serving, you know, a similar person. We do that with the Office of Mental Health in all 3 counties, you know, Seneca, Huga, and Yates, that I already am aware of because that was when I was involved in the clinic. So, yeah, definitely. I mean, we would not want to, you know, we want the best for the whole person. So we wouldn't want to step on toes and we don't want to take patients from that clinic if they're already, you know, being seen in that clinic. We want to be able to, you know, we came into the community because we want to help meet the need that's not being met, not take from another place. That's why I say we won't do vocational services in Tompkins County because we have an alliance with Challenge and they already provide vocational services. So we would never want to take services away from another, you know, organization that is already up and running.
Thank you.
Yeah, Jan.
I have a couple of things. One is lately I heard you say it and then I've heard other people say it and refer to Challenge as Challenge Industries, which is what it was known as back in the 1990s and early 2000s, but it was changed to Challenge Workforce Solutions. And I wondered if it has been changed back or is it just that you're kind of mixing the name?
They interchange them all the time.
It would be nice for the community if it were like one name, but I understand how hard it is to get out of the habit of a name that's been around forever.
Yeah, because I've heard Challenge Industries way more than I've heard Challenge Workforce Solutions. I thought it was the other way. I thought it was Challenge Workforce Solutions years ago, and now it was Challenge Industries. So I will pass that along.
Yeah,
like I said,
that
our
was
alliance has been 1 year.
That was developed probably about, I don't know, maybe 15 years ago, the Challenge Workforce Solutions. And then also I wanted to say that Challenge used to have an Article 16 clinic. It was actually one of my first positions is as a rehab counselor when I was getting my MSW. So they did have one at one time, but I believe it was stopped because they then got into the ops contract that was much more lucrative.
I was not aware of that either. Things you can find out, just, you know, attending a meeting.
Any other questions for Denise? All right, good. Well, thank you so much for filling us in and
Well, thank you for
answering
having me,
questions.
and I appreciate all the little tidbits of information that I got here today. So if you have questions in the future, please just reach out. Harmony knows how to get a hold of me and I can get you the information. Sheila.
Yeah, and maybe Harmony, you'll be in contact with Denise, and just give us updates on the how the clinic is, you're hiring and how the clinic is and the services unfold. That would be helpful.
Absolutely.
Thank you.
Great. You're welcome to
Well, thank
stay
you.
for the meeting, Denise, but we would certainly understand if you need to.
I
do
appreciate
other
you letting me go. I've been working since 7:30 this morning, so.
things. Of course.
Have a nice night, everybody.
Thank you.
Thank you.
Bye-bye.
Good. All right. So we can move on to Frank's report. Do that.
Great, thanks, Mary. And for with all due respect to our friends at Mosaic, if you know of a psychiatrist that wants to work in Tompkins County, please send them my way first, because we need them as well. We all are. Dr. Dupont is everybody's psychiatrist. So just a few things to update folks on. First, we have, I think, 4 members of the board whose term is ending at the end of this year. Karan has reached out to them to find out about their interest in reappointment. So please check your email if you're one of those folks, and let us know so we can get that process underway. As far as remote meetings go, this will likely be our last one.
Oh.
The executive order is set to expire at midnight tonight, so we squeaked in under the wire for this month. But
Wow.
The governor is hinting that she's not going to renew that executive order. So what that means is we will still broadcast the meetings. We have the technology in our conference room here. So we will meet in the mental health building and the 6th floor like we used to pre-COVID. And we have technology there that will allow us to stream the meetings. You do not have to attend in person to participate, but in order to count towards quorum, you will need to be in person. So particularly with our current vacancies, we will need as many people as possible to be here in person. Good news is the Green Street Garage did just reopen.
Yeah.
So there is public parking right across the street from the building that from the looks of it, people are not yet parking in. It still seems pretty empty. So there should be plenty of opportunity to park over there. Couple of other updates, just quick.
Frank?
Yes, I'm sorry.
Can I just interrupt now for the subcommittees? Do the subcommittees, can they continue to meet virtually?
Yes. The subcommittees can still meet virtually. I'm going to reconfirm that with the new county attorney. The previous county attorney was pretty confident that it was just the board because you're the decision-making authority. The subcommittees just advise you. And so therefore they didn't fall under the same level of open meetings requirement. Great. Switching over, just wanted to talk briefly about vaccines because some of the populations we serve will be seeking different types of vaccines. Starting with COVID, there is a new bivalent vaccine that is targeted towards the Omicron variants that are most prevalent. They're a little hard to find in the county right now because the pharmacies are in the ordering process, but I expect over the coming days and weeks, they'll become more readily available. We are not planning a large-scale pod at the health department. We are going to rely on the healthcare system and pharmacies to deal with the initial demand. If we find that demand isn't being met in a few weeks, then we might consider doing something different. But right now, we're directing people to their pharmacies or their healthcare providers. And then you maybe have some interest in the monkeypox vaccine as well. We did do clinics last week and vaccinated about 70 people. There's not a lot of demand at this point. We actually were one of the first smaller counties to get vaccine, but the bigger counties were already seeing demand taper off when we were getting our first round of vaccine. So we're kind of caught in this middle ground of trying to figure out what demand is, but we will have another clinic probably next week when we get more vaccine, and then likely we will just incorporate it into our regular vaccine clinics on Friday at the health department for folks that are interested. That goes the same for the COVID vaccine as well. So more to come on that, but that's kind of the vaccine news.
Just a quick comment on that.
Yeah, sure.
Northeast Pediatrics has already started giving out the bivalent vaccine, and I would expect other primary care medical offices kind of across the county to be kind of following suit. So if pharmacies don't have it yet, encouraging people to check with their primary care office is a good way to go.
Yeah, absolutely. And we actually just ordered some vaccine in order to be able to be a distributor to smaller practices or folks or healthcare providers that only have, a handful of people that want to be vaccinated and don't want to have to order, 100, 200, 300 doses. So we're going to try to facilitate that as well. Our hope is to really push people to their medical home for this, to kind of change that behavior going forward. Oh, great. An update on kind of opioid work. Harmony and Brenda Crosby from the health department have been taking the lead on looking at the opioid settlement dollars and working on, some ideas that we can present to the legislature. We're preparing that for the next HHS committee meeting, which will be next week. I believe it's Monday. So I'll be presenting some of the ideas. We are going to recommend that they form a task force that can look at opioid issues and help make some decisions about where the opioid funding should be directed. So that will be one of the big things we're recommending. And then we do have some recommendations that we're kind of putting pencil to paper on to see if they might be of interest as well. There's a lot of community interest. And there's a lot of different directions on how to possibly use the funds. We don't even know how much we're getting at this point. There's still some uncertainty about that. So we want to make sure we know, kind of what we can expect to be receiving both one time and then on a recurring basis, because that should influence decision-making on how those dollars are spent. Those are not coming through the LGU, just so you know, so they will be treated differently. They come directly to the county, and so the legislature has more of a role in the decision-making on those.
Okay.
Harmony has been looking into it. It does look like there might be some LGU funding coming. Harmony's trying to get on the statewide committee that's going to be looking at those. So we have some influence on that part as well. Once that process happens, I imagine that will be coupled with the other opioid settlement monies, but certainly the board will have, an opportunity to have a voice in those dollars that come to us through the LGU. All right, so if you're interested in that subject, certainly tune into the HHS committee next week. And then the last thing that I wanted to share was about our most recent audit. This is the first time I'm talking about an audit and not dreading having to bring it up because it's predominantly good news. So for those that have been around for a while, we've had some struggles in the clinic that we've worked really hard to try to address, and we're really proud that this audit really shows the results of that, including having, audited a time where we were completely converting to telehealth and dealing with all the issues that come along with COVID. So in that report, we had 4 exemplaries. Which for those that are unfamiliar, it's where the state is actually calling out as a model the work that we're doing. We've never had more than 1 in an audit. So we were excited for that. In PROS, 1 was around the array of services that we provided. They really talk about our PROS program as a model, right, in the work that Heather Stanford and her team are doing. So the array of services in the physical environment were the 2 in PROS, and then our crisis services that we provide and the physical environment for the clinic were the other 2 exemplaries. We did have citations. We actually had 7 of them, which might sound like a lot, but compared to our past history is actually very, very small. And they're actually, we have 7 because most of them we were doing in PROS and the clinic, so you get 1 for each. They were around assessments, namely self-harm and violence. Not that we were not assessing, we were screening, and our notes had documentation of our approach to dealing with those issues, but we did not have documentation of more in-depth assessments being completed. So we're already working on that and trying to get some measures in place to make sure that is no longer the case. And then the others were around discharge and non-admission. They just found that there was not sufficient documentation to their liking on either of those issues about us communicating what it means and how folks can re-engage with the clinic. So we are working to put new processes in place around those two issues as well. So on the kind of grand scheme of things, this was a very, very good audit for us. Our license was renewed for an additional 3 years in both the clinic and pros. And Harmony's working with the team to put the performance improvement plan together for those 7 items that we needed to address. So just wanted to share that with this group. It's good to finally be sharing good news about an audit. It's been a long road. And that's all that I had, Mary, and I'm happy to answer any questions anyone has.
Well, congratulations to you and Harmony and the whole staff on that. That's huge. That's great.
Thank you.
Any questions for Frank? Okay. Jan, are you? Okay.
I was going to just ask, I think that's great too, but I was going to ask, wasn't there a citation at the last audit or the one before that about the suicide assessments and self-harm and assessments at the beginning of, I thought that same thing had come up before.
Yeah, the assessments and around safety planning, it is recurring, so that's not good news. But I think it's not a complete absence, which is what we were faced with in the past. I think we've come a long way in doing some initial screenings and capturing some of that in our progress notes. We're just not all the way there, and more importantly, consistent with the further assessments that need to be completed. So the leadership team is already working on trying to figure that out, and we have some new steps and processes, including some additional reviews from our leadership folks to make sure that those are occurring, and more importantly, occurring consistently.
That's great. Thank you.
Great. Well, let's turn to Harmony and hear her report.
So I sent you a lot of papers, and it's really okay if you didn't get to read all of them. A lot of that
Harmony,
stuff.
your microphone has got feedback in it.
Okay. Does it still have feedback?
Yeah.
I never had that issue until now.
Can I ask something while she's working on that?
Sure.
You know how Mosaic talked about now Tompkins County is an ARC. Tompkins County, I mean, people change and the county's changed over time. But I know that initially, for a very long time, there was a strong community interest in or disinterest in becoming part of an ARC. Do you know anything about that, Frank or Harmony, about like what that actually means and what that might change or indicate?
Yeah, I don't particularly. Honestly, it's the first that I've heard of it, but Harmony's been working more closely with them. I don't know if she has any insight to that.
Oh, there's my mic's on now.
Same deal.
Okay.
Do you want me to go through the bylaws and you can relocate over here? If that's okay with you, Mary?
Good idea.
All right. So I can jump right into that. We emailed out probably several versions over the last week or so of 3 documents of interest. The one for your consideration tonight is the bylaws of the Community Services Board. But the Board of Health is also going through a similar process. So we wanted you to have their bylaws as well. They did vote to send that version forward at their last meeting. So that is, the current version that they're proposing to the legislature. And then the third document is the charter changes for the merged department. So I've been working with the county attorney, with the clerk of the legislature, to bring the charter together under a single chapter with our new department, which it will be called the Tompkins County Department of Whole Health. So we wanted you to have the charter language too, because it does, it to some degree impact the bylaws as well. Just a little bit of insight in the charter development for you. It's mostly public health law and mental hygiene law, so there's not a lot of changing to occur. Much of the change was around addressing us as a singular department, but it still delineates separately the public health law requirements and the mental hygiene law requirements. And probably the most important thing of note and of interest to the board would be the appointment of the DCS. So the way that the charter currently stands is that the working title for my position, the department head, would be the Commissioner of Whole Health. That person by default would hold the title of public health, the responsibilities of public health director, and the responsibilities of the director of community services. If the person in that position is unable to do either, they would be responsible for hiring a deputy to fill those other roles. The thing of note for the board is that the charter outlines that the department head, as the hiring authority, would follow the same practice of consulting with the Community Services Board and/or the Board of Health as appropriate, and would have a process that similarly follows the department head appointment, which is run by the county administrator. So I wanted to point that out because that was important to me, because I wanted to make sure that we had delineated in the charter the process that would allow for the appointment of those deputies by the department head, but still have the appropriate input from the appropriate advisory board. So that language is in there. The county attorney has reviewed it and believes that that is the intent is what the intent is clear in the language that's been proposed in the charter. So the charter is really just an FYI. If you have any questions or input, we're certainly willing to take that. The bylaws are the bigger part of your decision making, your bylaws. Before I go to that, I just want to outline the process that we're going to be following moving forward. You all review your bylaws tonight. I'm assuming that you'll approve them in some form. They will then go to the HHS committee next week as well, and they will have a chance to have discussion. It's not a voting item. So we wanted to make sure you guys have had all your chances to review and give input. We want to give them the same opportunity. So that's what will happen in September, and then barring any changes that need to be made because of HHS input, we will begin the formal process of approving the charter and approving the bylaws in October. The bylaws just require a vote of the legislature. Well, it has to go through HHS and then a vote of the legislature. The charter has to go to the Government Operations Committee and HHS. Then there has to be a public hearing before the legislature can vote to approve it. So that will happen, those will happen on parallel paths, but won't start formally until October. We're hoping to have that process completed by the second legislature meeting in November. So it gives the clerk of the legislature the month of December to get the charter, all the documents to the State Department at New York. So we'll be kind of jumping off January 1 as that new department. So that's kind of the procedural process. So that brings us to the bylaws. I want to thank the folks that participated on the bylaws committee that did a lot of work to kind of update those, and then also participated in a joint meeting with the bylaw committee from Board of Health to look at where there could be some consistencies. And I think there was some really good conversation there, which has ultimately led to the draft bylaws that are in front of you today. The really only, I think the only thing that is of any real controversy in there was related to term limits. And I will tell you, there are currently no term limits in the bylaws for the Community Services Board. The Board of Health chose to have and maintain their term limits, so they will be different, assuming the legislature doesn't have a different feeling about that as it goes through the process. Otherwise, all of the changes that have been suggested, I think, have been incorporated. The clerk of the legislature wanted some language that needed to be in there because of county law and county policy. Some around 3 consecutive meetings means the legislature can, if you miss 3 consecutive meetings, the legislature can immediately remove you and appoint somebody else. But we left in the language that was less restrictive, or maybe more restrictive, that gives the chair the opportunity, if somebody has missed multiple meetings, to have a conversation and then make a recommendation to the legislature if they feel it appropriate. So that both languages are still in there. And otherwise, I think generally speaking, we changed the language to talk about a single department. We also updated the language to substance use disorders. Everywhere it used to talk about substance abuse. So that language has all been updated in the bylaws as well as the charter. But otherwise, I think the bylaws are in a good place. I think they reflect all the conversation you've had. And I would certainly recommend that you move them forward to the legislature. But I would defer to those that participated on the committee if you guys have anything else you wanted to add and or make a motion.
Any comments, Sheila or Stu?
I think they worked out well. We had a lot of feedback from the members of the board, and Sheila and I.
Yeah, I agree. I think the conversation that we had with the Board of Health was great, and I think I'm satisfied with the bylaws as they are currently written.
I was just curious about when the term what is it, whole health? You're the whole health commissioner, Frank?
So that's a working title that I needed something to do this. I really need HR. I need the HR department to review it and figure it out. But if you guys have a better suggestion, I'm all ears. I'm just trying to move this stuff forward everywhere I can. And I'm not the most creative person in the world. Yeah. So.
No, I like the term. Health. I think you had some other, or we had some other different titles, and it just wasn't representing what that was what we are all about, or the title was all about. I think this is a lot closer. So my comment is that's good.
Frank, is the title, the name, is that subject to the legislature approving it?
Yeah. So that's probably the biggest thing in the charter is them, adopting a new department with a new name. The HHS committee has been made aware, just as you guys were, of the process and had a chance to weigh in. So I don't think we're going to run any issue with that, but the charter adoption would be the official renaming of the department.
Okay, and also just to confirm, the legislature, we decided that we did not want term limits, but the legislature could disagree and impose term limits. Is that correct?
Correct. That is correct. So your bylaws, you're recommending them to the legislature. The legislature has to approve them. So that's one of the reasons we built in an extra HHS meeting, was I wanted to get all that worked out before we got into the formal process, because that could slow it down. So this way, if they say on Monday, no, we want something different in either the charter or the bylaws, we'll have a month to make that happen before their next meeting, where the formal process would start. So if that comes out from them, I'd immediately be reaching out to the committee to say, hey, this is what they've said. How do you want to address it? And then ultimately, if there were changes that needed to be made, they would come back to this board at your next meeting, your October meeting, for another approval if they needed to be changed.
Right. Okay.
So that brings a question for me, where the legislator meets to approve our revised bylaws, when will that take place?
So they're meeting Monday, HHS, the Health and Human Services Committee, which is the committee we report to. They will be reviewing all three of those documents at their next meeting on Monday.
Okay. So to address what Sheila was saying, legislator could have their own opinion as to and enforce that. We would know that by Tuesday.
Yes, we should know it by Tuesday.
Okay, good. Thanks.
Jan?
Did I read that the Board of Health has, is it like multiple, a longer year term, even though they don't have any term limits, but aren't they longer terms, or was it 6 years?
6.
Yeah, so they have 2 6-year terms
Okay.
that they're able to fill. The Board of Health only has 8 members. One of them is a legislator. So Shauna Black still fills that role. So the way that that's designed is that each year one position comes open. So it was designed that way. So you only had one potential turnover each year.
That's nice. That's a nice design. I mean, that and with longer terms, you solve that problem that we've talked about before of people not having enough grounding in what they're there for and what it's about. So that's kind of that seems like a good arrangement.
Yeah. So the Community Services Board, they're 4 years.
Yeah.
They're 4 years. So it's a little bit shorter, and there's more people. And we've also found that longer terms tend to shy people away, right? Because it feels like a longer commitment. So it's certainly something to consider if you guys choose to do something differently. But right now, they're designed at 4-year terms.
I saw a difference, striking difference between, we have a 4-year term, they have a 6-year term, but they also mentioned that very few people go past 6 years. That there's maybe 2, I think, on the board that are in their second term.
Yeah, there's 2 right now. We've had quite a bit of turnover because of people having been on the board for a very long time. I will tell you that I would say for the first 5 years of the 11 years that I've been here, there was very little turnover in the Board of Health because there was folks that have been there for quite some time. And then they hit their 12-year or beyond because there used to be a waiver in the Board of Health bylaws that said if the legislature waived the term limit, somebody could be reappointed. The clerk of the legislature wanted that removed. She said either term limits or no term limits. So that's going to go away, which will actually, put us in a position. But the Board of Health, I don't take this the wrong way, but it's a bit more intense in that they have significant regulatory requirements, including the issuance of fines in our environmental health, regulatory services. So I think folks, 12 years tends to be enough. It has been, what we found there. So it's not as significant an issue of folks either being on for very, very long terms past the 12 years. But turnover, there hasn't been a lot of turnover. I guess I don't want it to sound like there's been a lot of turnover because folks are in we only have 2 people in their second term.
Well, I think another benefit of the revision is that we've codified some of the things we've talked about, but never quite put in writing and had difficulty remembering sometimes. So I think it'll be, a more useful document for us with some of these changes too. So Frank, do you need a motion to?
Yes, please.
I'll make the motion that we approve the revised bylaws.
I'll second it.
Second from Travis. Any more discussion about them? Okay, all in favor of forwarding them to the legislature? Okay, I think we've got it. So Thanks.
Thank you all. It's been a lot of work. I know those of you that have been on the committee have done a lot. We have some members that aren't with us anymore that have done a lot. And I really do appreciate it, because I know for some of you, this was kind of an idea that I thrust upon you, going on almost 6 years ago now. And it's really exciting to be getting to this point where we are going to be one thing. We're already acting that way, which is really exciting. And I'm really excited to present this to the community in a way that we are one thing now. We're going to serve you better because of it. So thank you all for your work in helping us get there. And I do agree that I think these new bylaws are going to make it easier for you to know, what your operational expectations are.
Great. All right.
I want to thank Sheila for steering the ship in its good direction and getting the great results that I think we got.
Thanks. And I want to extend my appreciation to you, Stu, and of course you, Mary, and the couple members that are not here anymore, but they were essential as well. So it was a really great collaborative effort, and I'm glad that we got it done.
Yeah, wonderful. Good. Thanks. Harmony, how are you doing?
You tell me.
Yeah,
Much better.
keep talking.
Okay. I need to test more often. It only seems to be in these meetings where there's an issue. So as you know, we normally do a local services plan process usually in the spring of the year. And we didn't do that this spring for a plan that is due in the fall, because there was a decision to revamp the entire local service planning process. They spent quite a bit of time figuring out how they wanted to revamp it. It was the work of state agencies, local government units in a committee, along with the Conference of Local Mental Hygiene Directors. They all worked together to look at what they thought they could do to really improve the process. And one of the things that they came up with was that it would really be a good idea to have a plan that looks at the mental hygiene needs. So that's Office of People with Developmental Disabilities, Office of Mental Health, and Office of Addiction Supports and Services, to look at it from a 4-year perspective, of a bigger plan. Because every year we look at trying to cram in this plan of all these big systemic changes you want to make, and 1 year just isn't sufficient. So the idea was, we'll move it to 4 years, and every year you can reevaluate your plan and sort of tweak it a bit. So they thought, that's a pretty big shift. We can't do that so quickly. So let's start that in 2024. And then the question became, what do we do for 2023? And it took them a while to get all of that work put together. So they wanted to create a plan that's shorter for this year. And they sent out a lot of the information. They said they were going to send out in August. They sent it out in September, on September 1st. And they said, by the way, you need to have your plan done on October 31st. So remember how many meetings we had last year in the subcommittees to talk about it? And we had other work groups outside. So that's why you got a lot of information over a very short period of time for me trying to figure out, how do we make a decent plan with a very short period of time? Because you have to approve that plan. You meet October 3rd. So that even makes a shorter window for us to get a plan put together with all the heavy lifting of the subcommittees, and then have it presented to you next month for its approval, so that we can get it implemented by October 31st, when the deadline is for this plan. So I put together this PowerPoint that I hope, and I hate when I go to share my screen, then I can't see anyone. So I might leave it open so you can see just don't pay attention to my slides on the side. I think if I do that, I still might be able to see your faces a little bit, which makes it a lot easier. We'll see if that happens or not. Yes, I can still see your faces, which is wonderful. So how do we make a local services plan in a very short amount of time? And the first thing is, the good news is that they recognize that this is not a lot of time. So this abbreviated plan is a lot less complicated than the normal plan that we normally do. There's 3 things that we have to do. The first is to identify our priority needs. The second is to support health equity and start working on just really getting some information on health equity so that we know better how we should plan to improve health equity for people in our community. They're starting, I sent you that information that today that they're really looking at how can we look at health equity first from a race lens, because there is historically been issues around people feeling like they can access our services because of the systemic discrimination and racism people have experienced. So that's the first area of health equity that the Conference of Local Mental Hygiene Directors, the LGU representatives, and the state agencies felt they should focus on. So, and the third part is after you look at that, setting some goals. So it is a shorter plan that I think is doable for us. So I just wanted to lay out some steps on maybe how we can go about doing that. The first thing is you want your plan to be informed by state agency plans and priorities. I gave you this PowerPoint because you can go back and look at these slides. One of the nice things they did this year was all of the 3 agencies, the mental hygiene agencies, gave a plan and a list of their priorities. I sent those to you too, not thinking you would have them read by today, but that you would have them and you could go back and look at them. And especially if you're on a subcommittee, you may want to just review the plan and the priorities for your particular subcommittee. But I highlighted on this slide some of the primary areas of focus that each of the state agencies is looking at for this 2023 year. And some of the things there's things in there they're bragging about and that they're proud of and that they're moving forward. But you'll see themes across them like workforce and how do we improve transportation challenges for people, and how do we address crisis services. Some of these you'll see there's crossover in all of the state agencies. One of the things the state agencies do is when we submit our local services plan, they evaluate them to find common areas that cross over the 3 mental hygiene areas. And that really informs their priorities and informs their budget process. So you see on the top of the slide, it talks about where were the biggest common themes across counties in 2022. And the first one was workforce recruitment. That was one of ours. We identified as a need. And 25 other counties also identified that as a need. Housing was the next one with 24 counties identifying that. Then crisis services, 23, we identified that one as well. Transportation was identified by 20 different counties. And so those areas are where the state really says, oh, these plans have informed us and we're going to look for funding and we're going to really address programs at the state level that can help meet those needs. So that's what they really use our data for. And then of course, our work has to be informed by what the state is saying are the priorities. So that's why it's important to know what each of those offices is looking at. And again, you have those documents now. You can take your time, read through them and see what they're looking at all of the different state agency levels with a little summary there of what they see as most important. So that should inform our planning process. The next thing that should inform our planning process is what did we think was really important last year and what work did we do? So I sent you a summary of each one of our objectives that was laid out in our plan. They are all green now. If you'll remember at the 6-month mark, we had some yellows and some reds. We did a lot of work in our plan. I think we made a lot of progress in achieving all of the objectives we laid out, but not all of them were complete. We identified, well, this could be a next step. So the subcommittees can now evaluate and then bring back to you, well, we did this work maybe on I'll pick on Mary, we talked about adverse childhood experiences. The mental health subcommittee actually had a meeting in August just to make sure that they finalized their work and their plan, knowing that we were going to have to do something here about our local services plan for 2023. So there were some ideas shared about what could we do in 2023 around that. So the group may say, you know what, that's not our biggest priority. We don't want to focus on it. Or they could say, here's some work we discussed at the end of this year that we think we might want to pick up in 2023. So our big priority needs were crisis services, workforce recruitment, prevention services, and OASIS, substance use disorder treatment services, heroin and opioid programs, children's treatment needs, including ACEs and problem gambling, and student transition services and OPWDD in particular. So one of the things they wanted to do was to start to simplify the list of priority needs. So they've reduced the number that we can select from down to 19. I don't think that's a bad thing. Some of them seem repetitive. Here's the list of the priority needs categories that we will have for the 2023 plan. The ones that are underlined there are ones that I think match with what our needs were last year. Outpatient treatment, well, substance use disorder treatment services falls under that. The work on opioid addictions falls under that as well, primarily. So those are the categories, and those were the things that we felt were really important last year. We may say we did enough work in a particular need area. We don't want to do that in the next year. We may have other things that we're going to want to really focus our attentions on in 2023. But those are the need categories. The next thing that supports our plan is data sources. These are just two examples. The key substance use indicators, I sent you in your packet more detailed information. This is what the state provided us on key substance use indicators. So opioid deaths per 100,000 in 2020, according to the state data, that was 16.2, and rest of state was 21.8. So that's what ROS stands for, rest of state there. So that little sheet, it's only 2 pages long, helps you see how we compare to the rest of the state. Then you look at emergency department visits for opioids, and our visit rate was 41. We're almost 100,000 people on our population. So that crude number, all this data is based on 100,000. So I think it was actually 42, but when they did the math, we got a number of 41 for our crude visit rate. And other counties ranged from 0 in Hamilton, New York to 122.4. I believe that was in Monroe County. But you can see right on that page how we compare in our opioid ED visits to every other county and New York City by borough. So that's information that could be really helpful for our substance use subcommittee to look at in particular. And then what is the alcohol? I looked at the alcohol related motor vehicles. I tried to pull out a few that seemed important, and rest of state was 26. We were 26.4 for alcohol related motor vehicle injuries in 2019. And that was compared to 35.5 per 100,000 in the rest of state. But we did see an increase in binge drinking. So rest of state is 21.2 compared to 18.4. So we're better than the rest of the state, but it was an increase also for us. And that information is all on that 2-page sheet, plus some additional information that might be helpful to our substance use subcommittee. These are only some small examples. I'll try to bring more information to each subcommittee. And I also wanted to make people aware that the Office of Mental Health has put a lot of effort into this vital signs dashboard, and I'll just show you what it looks like. You can use that link that's in this PowerPoint to find the vital signs dashboard, but I just want to spend a moment showing it to you what it looks like. You can put up here, this is statewide data, but you can put in here any county that you want, and you can also look at data based on, this is full mental health population. You can look at it from OMH licensed clinics, partial hospitalization programs, PROS programs. You can identify it by program, and you can also look at it by children or adults. And what it will do is it compares data for you in 3 different areas: access, treatment and outcomes, and then this quality domain. And you'll see the categories that the state is really looking at in the Office of Mental Health that they think is important. So here's the thing that's really wonderful about this chart is you can also look at it by race and ethnicity, and you can look at it by gender, or you can look at it by total population. And then you have either a table or a chart view that you can look at. And how they break the data down is when you maybe look at race or ethnicity, you'll see how are you performing as a county compared to the rest of the state. Are you equal to that? And then it'll get a little black dot. If you're higher than, you're like doing better than the rest of state. Generally, that means better. Sometimes it doesn't. You have to look at the category. Higher than the statewide performance average, you get a purple dot. And then if you're lower than the state average, you get this teal colored dot, like right down here in this section. So I wanted you to have that information available to you. You can go and click in there. You can look at how our PROS program looks compared to other PROS programs. You can look at how our county clinic looks compared to the clinic at Family and Children's Service if you want to. You could look at how it compares to programs in other counties. And then you can look at how we look overall, and then you can dig deeper and you can look at information around these factors around gender, race, and ethnicity. And sometimes you could look really great in one way when you look at all of the numbers combined and then say, oh, we have some work to do. And I think this will really inform some of our work around health equity as well. So wanted you to see that. And that is all based on Medicaid data only. And it's compared to rest of state. And so I think you have a good sense of how that is one very new resource that was developed by Office of Mental Health that I think is going to be really invaluable to us in figuring out what our needs and priorities are going forward. And then you received a survey and all of that stuff, the one thing that matters the most is go through that survey, complete it, and send it back to me. We're going to ask all of our subcommittee members to complete that survey as well and send it back to me and to the chair of their subcommittee so we can start gathering information. We have to do this relatively quickly given our tight timeline. So that information from our subcommittee members, and then we can identify in our subcommittees who else we might want to send that survey out to. That survey aligns exactly with how the needs, goals, and health equity information is being collected for our plan, how it's done. So when we look at supporting service providers and achieving health equity, that survey, that initial survey is really asking providers, well, what are you doing? And what kinds of needs do you have? Do you have training needs? Do you have more data needs? What things can we do to help support your work around health equity? So the work is guided by that universal definition and the plan that I gave to you today about what is health equity. You got that in your packet. And then let's survey our providers to find out how they're feeling, what they have done, and what supports that they need. We just looked at that dashboard that OMH developed that helps us start to collect benchmark data that can help inform our local services plan, probably more in 2024. This is really a year to start just figuring out what we want to do around health equity. And we may want to put a goal in our plan for 2023 around that. And it may be, let's just start collecting benchmark data at the local level. Let's talk to other agencies and find out what they're doing. Maybe we want to bring in a consultant that can help a lot of agencies collectively address health equity issues. So we know we want community voices. We're going to collect them through the survey, through our people that attend our subcommittees, and asking them who else in the community should we survey and collect that data as quickly as possible, and then work with our partner agencies on that, and then look at some of these state and local data sources. Those will help us identify our priority needs. So
Harmony, Jessica had a question about.
Oh, I'm sorry. I can't see all of you. Go ahead, Jessica.
That's okay. I was just wondering, I was looking at the survey you sent out. Is there a way to like answer those questions electronically, or do you want us to just like send you an email with our responses?
Just send them to me, like just click, you should be able to just click into the survey itself, and it will, like there's most of them are like yes or no
to me, but maybe
it should. We tried it. If it doesn't work, let me know. It should just like let you click a yes or no. And then when you get to, it should make just a little dot. It doesn't give you a lot of.
I tried, but maybe I was looking at the wrong copy.
Yeah, Harmony, I'm going to suggest tomorrow we try to drop this in the Survey Monkey.
Okay.
shouldn't be that difficult.
Okay.
Looking at it. So we can work with Karan tomorrow to make that happen. And then folks can just click on a link instead of having to use the Word document.
Okay, all right. And then just this final slide here, really how we're going to establish it. We're going to consider the state priorities that you have access to, evaluate the work we already did, see what we want to continue doing in the next year, and then identify our priority needs and goals in each subcommittee based on community input, and then establish our measurable objectives. They really just give you a box and say, write in what you're going to do about it. But I think the objectives model worked pretty well for us this last year, so we can just use that same format since we're pretty familiar with that. And then just make sure we're realistic. You have to have 3 goals for this abbreviated plan, and you can have up to 10 goals. So given how short our time frame is, it's important for us to be realistic about what we think we can really plan for in the next few weeks. And that is it.
So the plan will be for much of the work to happen in the subcommittees, and then we will vote on it at our October meeting.
Yes, and if you have ideas or other information, and once we get that, get your survey information, and if you have other ideas after this presentation of things that you think should go to one of the subcommittees, that would be good to do as well.
Sheila?
The GD subcommittee meets tomorrow, and I see that you're on the agenda. And then there's some time left. Is the expectation that we try to complete a lot of the work tomorrow's meeting?
There is, and I've talked with James and Jeff about that as well, so they know their portions of the agenda. I'm just gonna talk a little bit about the beginning portions of what we just did today, and then they're gonna really facilitate the needs discussion.
Okay, and then, and to, I think what Mary was asking, so it has to be completed by the October subcommittee meeting, or?
By the committee, well, I mean, it's due by October 31st, but you don't have a meeting at the end of the month. Your meeting's on October 3rd.
Yeah.
So that
Okay,
really
so we have a couple of meetings.
Time.
Okay,
Yeah.
Okay, all right. Thank you.
If I could just add 2 things, Mary, just real quick. First, just for those that are new and for those that aren't, this is now my 8th year being involved in the local services plan, and it has not been the same in any one of those 8 years. So they have changed the process every single year. We are hopeful, based on what Harmony is hearing, that this is going to shift to a multi-year plan, right? So instead of every year being something different that we're scrambling to do, it's going to be something we can really sink our teeth into, and then have it be the plan for multiple years, which I think makes sense. So I don't want folks to feel worried about the rushed time frame on this. This is almost a space holder until they launch the new process for next year. The things we're talking about can't be solved in a year, right? Much of it. So you're making steps towards that, which I think is what we've been doing. But now we're hopeful this new process will be longer. And also, while it doesn't align directly on the timeline, it's close to the community health assessment and community health improvement plan, which is required by the health department, which has identified the last 3 times mental health and substance use issues as a priority. So our hope is that those 2 things are going to come together for us, and it's going to be a really comprehensive process that we do every few years. And then we really spend our time trying to make the change, instead of every year going through a different process of trying to get this plan put together. So I want to offer some hope and light at the end of the tunnel that I think we are moving towards a better process.
Great.
And I think that's the feedback that they heard and why they put this whole group together, because it's frustrating to try and address really complicated things in a year time frame. So hopefully there'll be a much better process after this gap year that we have.
Good. Any other questions, thoughts? All right. All right, I think we've come to the end of our agenda here. Can I have a motion to adjourn? Sheila, and a second? Stu, or yeah, Stu, I think. All right, so all in favor of adjourning? Okay, thanks, everybody. And for our guests, thank you for being with us and learning more.
Thank you for having